Okay, we are live. Good afternoon, everyone, and welcome to day 4 of the Boys Town Pediatrics Fall Newborn Expo. My name is Gabby, and we have gone live every single day this week at noon to discuss a different topic to help you best prepare for the arrival of your newborn. Today, we are live with Rosemary Pauley, who is an APRN, to discuss when baby has tummy troubles. Rose, how are you doing today?
I'm fantastic.
Awesome. It's great to have you on, and we'll learn more about you and your role as we go through this discussion. Before then, I want to remind everyone that we are doing a live giveaway in this video. So if you are interested in winning a infant gift package from our friends over at Raising Cane's Chicken, leave a comment on this video and you can leave a question, just say hi, whatever you prefer, and we will do the live giveaway at the end after the Q&A. As part of the Q&A, go ahead and leave all your questions below, or if you want to message them privately to our page, we'll be checking that inbox as well. Okay, so Rose, tell us more about yourself and your role at Boys Town Pediatrics.
Okay. So, well, I've been a nurse for 39 years, and I've been an APRN for the last 20 years. And all but 2 of those years, I've worked with the pediatric gastroenterology group. And I've actually worked with my physician colleague, Dr. Vanderhoof, for 38 of those years. And we've been with Boys Town now for 18 years. And in this role, I support the physician, but I also independently see patients in the GI clinic with a variety of gastrointestinal problems from infancy to about age 19, 20, whenever we can get them transitioned if we need to. But we see a variety of all types of gastrointestinal problems. So that's really been my focus and passion for my whole career. And I believe strongly in the benefits of good nutrition, as well as controlling, of course, gastrointestinal diseases, but how important nutrition is for growing kids and babies. So that's really been a great experience to see over the years.
Yes. Well, we are very grateful to have your expertise, especially on this subject, as I'm sure you've helped hundreds of babies over the years with this. So it's great to have you on. Mm-hmm. So the first question we have here on our list is, what are some common reasons babies experience tummy trouble?
Well, this is a wide range of things. And, of course, the baby can't tell you it's their tummy, but we make assumptions that tummy troubles are happening when babies maybe spit up excessively, when they poop too much or poop not enough, when they're excessively fussy. Those are sort of the common general reasons, why we assume babies are having tummy trouble. More objectively, when we see babies that don't grow, regardless of the actual symptoms, that can be the only symptom, is that just poor growth. They might not be fussy or spitty or whatever, but if they don't grow, and that's why it's so important in the first year of life when you're following up with pediatricians is, they're always concerned about the rate of gain and the, how many ounces a day initially. And that's a big focus because that can really tell you if there's any significant diseases going on.
Mm-hmm. Yeah. The next question is, what are some signs that my baby is experiencing discomfort?
Well, that's a really good question because how does a baby express pain is, I guess the big question. And, all babies cry. I mean, crying is the only way for them to communicate. That's the only way. Especially even in the first 2 to 3 weeks of life, they don't even have a vision, they can't see well, and, their hearing is okay, but, crying is how they're communicating. So excessive crying, would be an indicator of that. And, excessive crying means usually that they cry more than 3 to 4 hours a day, or crying with feeding, crying with movement, those kind of things that you can obviously correlate the symptom with of crying. But that's mainly the way that the irritability is expressed, with things. And, early on, babies' neurological systems are very immature. And so some of their irritability and crying movements and whatever is related just to neurological development, not necessarily abnormalities. So it has to be pretty excessive and pretty severe type crying. I think a mom will tell you they can tell the difference between their baby crying when they're in pain, when they got a shot in their leg, versus the baby crying, when they have a wet diaper. I mean, there's different types of cry. So the intensity of the cry and the character of the cry can sometimes be helpful too.
To know, yeah. How can parents tell the difference between normal spit up or something more like GERD or reflux?
Right. So that's a really good question, because we know that 75 to 80% of all babies spit up. It's the minority that don't spit up. Okay. When a baby is born, there's the esophagus, which dumps into the stomach, and there's a little area of narrowing between where the stomach and the esophagus join together. And that area, people talk about it being a valve or a flap, but what it is actually a muscle that is around that area of joining. But in a baby, until they walk independently, till they can stand up and have good core control, that little opening is wide open. And so whatever pressure or excess feeding or anything can cause things to come up. That's just normal physiology. So if a baby is spitting up all the time, but they're not, excessively fussy, they're not losing weight, they're not getting any respiratory infections, that's normal spit up. A lot of times we'll talk about the fat, happy spitters where, they're growing great and they spit up and they look over at you and laugh. It's not really a disease. When it's a disease, is when they suffer consequences from the spitting up. And the number one thing would be poor weight gain. Do they spit up more such that, they don't absorb enough to gain weight? There are also cases, less common, where they might spit up or have what we call silent reflux, where it goes into their lungs and they get pneumonias and they get respiratory infections and they, those kind of things. I mean, that's another reflux condition that we take seriously, but it's mainly the lack of weight gain or complications from the spitting up that cause it to be a true disease that needs to be treated.
Okay. How can I help alleviate my baby's gas pain?
Gas pain. Well, the first thing we need to talk about is, why do they have gas pain?
Yeah.
You can have gas pain from swallowing too much air when you're crying, swallowing too much air when you're eating, or you can have gas pain from fermentation of the nutrients that you're not digesting. So, and also excessive carbohydrate intake in your nutrients can ferment, because we have a baseline, a number of enzymes to digest and absorb all of these things. And if you give your baby a lot of juice or a lot of fruit, carbohydrates are rapidly fermented to gas. And especially if you give them in, big chunks, like 3 ounces of juice at a time, or, something like that, there's a chance that a lot of that's going to be fermented right to gas. Not necessarily that that's abnormal. That's just our physiology. But, if you're having this excess gas, one thing you look at is, okay, are they crying too much? Do they have, there are some colicky babies that, between 2 to 5 months of age, they do cry excessively, and they don't necessarily have a disease going on, but the colic is more related to the immaturity of the nervous system again. And anyway, so the baby may cry, and, there are measures to deal then with treating the colic, treating from swaddling, especially when they're real young, swaddling tight, warm blankets, taking for a ride in the car, those sorts of things to help with the colic and the crying. If the gas is coming from the feeding, so the number one thing with that is the baby's head should always be above their chest or their tummy. If you're feeding them in a lying down or a side lying position, their chances of swallowing air is much, much higher. Different types of nipples. work for different babies. I mean, there are a plethora of nipples and bottles out there because there are some that do work better for different babies. And so usually it's switching to a slower flow nipple that helps with the gas that you get from eating. If the gas again is from fermentation, from excess carbohydrate, we talked about that, but you can also get gas from fermentation if your baby's maybe intolerant of a formula or the breast milk. If there's inflammation in the gut, in the small intestine from not digesting that milk or whatever kind of milk it is, that excess nutrients are fermented into gas. And so, sometimes it's a thing where you need to change formulas or change maybe what the mom is eating, because a lot of what comes through the breast milk is related to some of what the mom eats.
Yeah. Let's talk constipation. So what is it? Why does it happen with babies? And how do we relieve it?
Yeah. So good question again is, what is constipation? Constipation in a baby doesn't always relate to the frequency of pooping, because a breastfed baby can normally poop 8 or 10 times a day, and that can be normal for them. Or a breastfed baby may only poop once a week. There's a really broad range of what's normal for breastfed babies. Formula fed babies usually poop, in the first 2 to 3 months of life, they're pooping maybe 2 to 4 times a day. And then it slowly goes down as they get older. By the time they're 8, 9 months of age, both babies, breast or formula fed, are down to 1 or 2 poops a day, typically. So frequency is one question. What really defines constipation, though, is the consistency of the poop. If it's hard, it's large, it's really difficult to pass. It may be every day, maybe pooping every day, but if it's like that, that's constipation. So, that's the real thing. So if you have constipation, it a lot of times relates to what they're being fed, and that can be dealt with. But there are some diseases which cause bad constipation in babies too. As we mentioned before, with the excess carbohydrate causing fermentation, if the baby gets a lot of excess carbohydrates and that the ferments, a lot of times that'll loosen up their poops.
Okay.
So high carbohydrate things almost act like a laxative for babies. And so, that's why I'm just emphasizing that the diet can play a role in those situations. So. When it's a disease, a constipation, a baby that's really constipated as a disease, usually they have a lot of abdominal distension, to the point where the distension, their tummies feel really hard. You can see the blood vessels in the tummy. They can have a lot of trouble just passing gas. Those things where might lead you to think more of, there's a disease causing that. But those are extremely rare conditions that do that. So.
Yeah, definitely. So, constipation could be those hard and large stools. What other things should we look for when it comes to baby's poop?
We usually tell people we don't care what the color of the poop is, as long as it's not red or white. It could be any variation from green to brown to yellow to black to dark brown, a lot of variations in between that. If you have white clay colored poop, that sometimes can indicate liver disease, but that means that every poop is that color, not just one here and there, but every poop was that color. And the same way with red poop. Obviously that's blood, or that looks like mucousy blood, slimy red things. Those things are abnormal, and that can come from, again, formula allergies or breast milk colitis. Infections can cause bloody poops. Antibiotics can cause bloody poops. There's reasons for a lot of those things, and that are easily fixed usually. So.
Yeah, and then consistency, is runny poop a problem, or what can it
be? Again, like a mushy cow pie poop is okay, but if you have poop that has a big water ring around it, that's not normal. So you don't want a real watery, you can see a water ring typically when it's abnormal, but there can be a lot of variability in that. There's some babies that poop peanut butter, little soft little hot dogs from the beginning, and some that always poop, mushy cow pies. I mean, there's variability, just as is there in adults. I mean, there's a lot of variability in that too. So.
Mm-hmm. So if a parent watching, is concerned about their baby's poop, do you recommend they just call their pediatrician up right away?
Take pictures. We love pictures, I mean, the pediatricians I'm sure do too, but with the advent, I've been doing this 40 years now, and it's so nice when a mom comes in with pictures, the poop was this way, or various things. I mean, that's the best thing to do. And, with Boys Town's portal, I get pictures uploaded to the portal, and, look at poops all the time. And yeah, it's helpful because it's sometimes hard for people to describe, especially the consistency and
Right.
that sort of thing. Yeah.
All right, perfect. We've got a few questions on allergens. So what are the common allergies that babies have? Are there some?
Well, the most common allergen per se is usually related to the nutrition part of it. Babies can get some environmental allergies, but those are pretty rare early on. Like the seasonal allergies and blah, 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 that babies they're not born with sinuses. And so they have a lot of protective immune globulins that come through from the mom that are there in the first 2 to 3 months of life. So typically, if you're talking allergy that's related to nutrition, the most common thing is a baby can be allergic to dairy proteins, and it can be the dairy proteins coming through the breast milk or cow's milk protein coming from the cow or from formulas. The physiology of the human being is that we're really made to have breast milk from day one, and cow's milk is for baby cows. It's we've been able to pasteurize and modify cow's milk for use in baby's formula for 50 plus years. And, it's safe and well tolerated by the majority of babies when they can't breastfeed. So, I mean, it's not, not that you can't have it. It's just that, it's most common if you're going to have an allergy, it's going to be to the protein in cow's milk. So.
If our baby is showing signs, or if we think our baby might be allergic, what are those signs to look for?
So, I think the number one thing that we see, especially in our clinic, probably the pediatricians too, is the excessive spitting up. Okay. People are always wondering, is all this spit up, is that related or not? And spit up that, again, occurs in association with weight loss or occurs that's really painful can be a sign of cow's milk allergy, because when the food gets through the stomach and dumps into the small intestine for digestion and absorption, that's where the allergy typically manifests itself. And so when all that inflammation is there, it doesn't let the stomach empty. And so things come up even worse, and the babies have a lot of pain with eating. They'll be hungry and they'll want to eat, and then they'll like fight the bottle, because the minute the formula starts coming in, it causes pain. So, typically, again, they'll manifest that with weight loss because they can't, get in enough, and they're not digesting and absorbing enough. If the inflammation goes through the small intestine way down to the large intestine, you can get bloody poops. That colitis, allergic colitis they get from that. Causes blood in the poop. It can be hidden blood at first. You might not see it. You might just see mucus at first, or you might see visible blood, either way. So it can affect the whole GI tract from swallowing to where the poop comes out, that kind of irritation. It's pretty rare for babies. I mean, there are rare cases. I think I've seen one in 40 years of somebody that had an intolerance to sucrose. So sucrose isomaltase deficiency can sometimes look like an allergy, or people call that an allergy, but that's a true genetic enzyme defect and pretty rare. But you can't be allergic to fat. The fat that comes through breast milk or formula to be allergic to something, it has to be a protein source. So, it's typically, again, their sole source of nutrition, whatever that is, breast milk or formula, and the protein in that product. So,
Can babies be allergy tested?
good question. So, the allergy tests that people talk about or think about are either usually blood tests or those little skin prick tests. Those only test for the allergies that are what we call IgE mediated, or the kind that gives you like hives, rashes, that those kind of acute onset type. And you typically don't need allergy testing for those, because every time they get that, that's their reaction.
Yeah.
The allergy testing for what I'm talking about in gastroenterology is a delayed hypersensitivity type reaction. And you can diagnose it, but you have to do biopsies of the intestine. So that means anesthesia, going to sleep, going under endoscopy, blah, blah. We typically don't do that anymore. When I first started, we did a little bit of that. But even then, once we had the advent of all these new formulas that are designed specifically for babies with allergy, we tell parents the best thing to do is a 3-week trial of that formula. If they get better, then we have our diagnosis. We know what it is. And if they don't respond, okay, then we go on with other kinds of workup or whatever.
So for those babies who are maybe having a lot of spit up or reactivity to the formula that they're on, how do you know when to switch formulas, and how do you know what to switch to?
Yeah. Well, I would always recommend talking to your pediatrician first. That I really am dismayed when people come to clinic and have gone through formula roulette on their own, and if you're not sure what class of formulas to switch to, and you're just switching between 6 different types of the same class of formula, you're kind of wasting your time. That there are 3 different levels of formulas for babies. So there's the whole cow's milk formula. Then there's one that's like partially broken down level. And then there are ones that are completely elemental, or what we call amino acid formulas. So rarely do you have to go from, the top to the Cadillac. Usually you might be able to use one in between or something like that. So my first suggestion would be always just to check with your pediatrician first. And if they feel it's warranted, then I'm sure they would have a recommendation for you what to try next. But yeah, I mean, there's so many, the marketing to consumers now for these formulas and things has been kind of confusing for people to know what to do best. So it's better to check with your doctor.
Yeah, for sure. What about vitamin D drops? Do they ever cause tummy trouble for some babies?
Rarely tummy trouble. Vitamin D is a fat soluble vitamin. And unlike all the water soluble vitamins, vitamin D, well, actually A, D, E, and K, because they're fat soluble, they can be overdosed, you might say. And if you're going to have problems with vitamin D toxicity, typically the symptoms appear as a result of excess calcium in the system. So vitamin D affects the calcium absorption. And so the vitamin D itself didn't cause it, but this excess calcium in the body, you can get kidney stones, you can get gallstones, you can get muscle, quivering or twitching of the muscles almost to look like a seizures, because the calcium is so important for the muscle contractions and things. So very, very rare. I mean, you have to really give an excessive amount for it to be a problem. But as far as causing tummy troubles, is that the basic question? No, really, it doesn't.
Okay. We just have a few more questions for Rose here, and then we will jump into the Q&A. So if you're watching and you have a question on anything we've been discussing, now is the time to leave it in the comments. I apologize. I think one of my questions above, I asked, is it this or is it GERD? And we didn't even define GERD. So could you define that quick?
So GERD is reflux that's a disease. So okay. GERD, it's a disease. And disease means that, you need to intervene, and it's going to cause complications if you don't. So if you have enough reflux and vomiting to cause poor weight gain, to cause, respiratory compromise, that, it's eroding the esophagus. Say you get to the point where, typically if a baby is walking, and they've been walking for a couple months and they're still spitting up, spitting up all the time, we will look in the esophagus and see, do they have acid damage? Do they have bile irritation? Do they have, something that's causing the disease and that requires more intervention?
Mm-hmm.
There's medications we can use, usually as a first try if it's not allergy related, but we really, really don't recommend putting babies on acid suppressing medicine unless they have true GERD, not just for reflux, not for vomiting, but using acid suppressing medicines was really common about 10 years ago. Every baby that spit up, I think, got put on them. It doesn't change the spit up. It doesn't, impact the physiology of what's going on. And what it does do is it decreases your acid loving bacteria, which is really important for babies because that acid loving bacteria, especially in their stomach, kills a lot of viruses that we're exposed to. And so there really is a trend away from using those medicines, even though people like to think, oh, they're going to give me a medicine to fix my baby spitting up. Well, it doesn't really work anyway, and it probably causes more complications. And yeah, you might have to replace your carpet in a year or two, but it's better not to use the medicine if you can.
Yeah, have that good bacteria in the gut.
Yeah.
So we touched briefly on nutrition for the parent, but if I am breastfeeding, do I need to be conscious of my diet or make changes if I see my baby is having some of the issues we discussed, like spitting up?
So that's a good question. There's all these theories out there about what the mom eats and how it affects the baby, and it's possible that every time mom eats a strawberry, the baby spits up more or has diarrhea, whatever. I mean, if that's truly present, the mom will know. The mom will know there's a true correlation. Otherwise, in general, if you have a baby that you're suspecting maybe they're a little bit intolerant of the protein in the breast milk, that sort of thing, we typically do have moms try off of dairy for 3 weeks, just off of all the cheese, milk, ice cream, yogurt, everything, and try to be real strict about it for 3 weeks. If you can be real strict for the 3 weeks, you'll know if the baby gets better again right away. But other than using the cow's milk restriction, that's about the only thing we typically recommend, unless, like I said, the baby obviously is reacting every time mom eats shrimp or one of those easier to figure out things. So
sure.
Yeah.
So how can I soothe the discomfort if my baby is experiencing that? I always have thought of when you take their legs and kind of push them up and move them around. Are there good techniques for that? Or
yeah, not that I recommend deep tissue massage or anything, but massaging the belly, bicycling the legs really can help them get rid of gas. That's for sure. Again, ways to figure out why they're getting that excess gas, changing the nipple type or those kind of things. But good burping is really important. I don't think I mentioned that before, taking the time and really trying to burp the baby, and a lot of times it's going to take mom or dad standing up, getting the baby's legs kind of stretched out, getting a good burp, a little bit of pressure on the tummy when they're burping, that can make a big difference. And again, pumping the legs is always good. But yeah, there are some gas drops, Milacon drops, or simethicone drops, I think is the generic name. Those can be helpful. The problem with simethicone drops is the minute they hit the bubble, it breaks it apart. So if the baby eats and then has gas 2 hours later, giving them gas drops is probably not going to help the gas that's way down in the colon. It's just not going to get down that far. But simethicone drops are safe to use if it does seem to be more related to immediately after eating or with eating, that kind of thing. So that can be tried. And those are over the counter, and they're you really can't overdose on anything like that. I have some, sometimes people use them every 2 to 3 hours, and that's totally fine.
Sure. Okay, so, if my baby is experiencing anything that we've talked about, what specialist can help me if those tummy troubles don't improve after I try to sue that home.
Yeah. So, of course, your pediatrician is your go-to person, and typically they will recommend seeing a gastroenterologist or pediatric GI person if there are obvious issues with weight gain or irritability that's not controlled, or blood in the poop, that sort of thing. So, that's sort of our big focus area. So, it would be with us, I guess. Not that we need a referral from a pediatrician, but it's always better to have one kind of person that oversees the total care of your baby, and they should be aware of what's going on. So.
Definitely. So we'll make sure to link in the comments our meet and greet forms for our pediatricians. So if you're expecting and you want to get a pediatrician set up with Boys Town, link that form. You can do it both virtually or in person. And then I'll also add all of the information for Rose's clinic and our awesome physicians there. So
Great.
Perfect. Well, thank you. Let's jump into the Q&A. I see a lot of great questions coming through. So Thanks everyone for watching live. If you're watching later this evening and you weren't able to leave a live question and you still have anything remaining, you can go ahead and leave in the comments or message our page, and I'm happy to facilitate an answer for you. Okay, this question says, if my baby sometimes cries when eating, is it a sign of colic?
Not necessarily colic. Colic is more of that, there's just inconsolable crying that typically occurs later in the day. And again, that relates to the nervous system immaturity. As the babies are awake and more stimulated during the daytime, a lot of times they kind of reach a breaking point. And so that's when their irritability is the most significant, from 5 to 9, or that's sort of the typical hours. But related to eating would make you think more about maybe there is something that's not sitting right with them with their whatever product they're receiving for their nutrition. If especially if they eat and they pull away from the bottle or that sort of thing.
Yeah. What position is the best for burping baby after feeding?
Yeah. So typically the best way is that they're up over the shoulder, their chest or tummy's kind of pressed against your shoulder, their legs are extended, and they're upright, of course. You can do it, if they can sit up on your leg, and you can hold their chin and head up enough that, they're not all compressed down like this, to burp. You can do that and pat them on the back. Either of those ways are preferable.
Perfect. We had a couple questions on gripe water. Do you want to talk about what it is and when is it okay to start giving it, is the question?
Gripe water has been around for a long time, and it's certainly fine to use. It's safe to use. I typically tell parents to use maybe Pedialyte instead of gripe water. Just there's no science behind the gripe water, so that's why I don't tend to go that way. And I know the reason I like Pedialyte is because I know it's sterile. It's manufactured in a high quality facility that assures all of those kind of things. And it has a little tiny bit of glucose and some salt in it. And so, especially if the babies are really fussy and they just need to get calmed down, a lot of times just giving them an ounce or half ounce of Pedialyte is good, just to kind of settle their tummy. That's really helpful too, initially when we're treating the babies that are allergic to the cow's milk, because they're so nutrient deprived. A lot of times they will overeat and want to eat all the time. And, you've just given them 4 ounces, they can't handle any more than that, or they'll spit up. You give them a half ounce of Pedialyte afterwards, and that kind of calms their stomach down. But gripe water is okay to use too. Again, I'm not saying there's anything bad about it. It's been around for a long time, but just because there's no science behind it, is typically why we sort of promote the Pedialyte instead, but it's fine.
Yeah. Does mom refraining from dairy potentially result in baby having a dairy intolerance?
Okay, so like mom's a vegan maybe, or something like that.
Doesn't eat dairy.
That's a really, really important point to talk about, because we didn't used to think that it made any difference, but now we do know that if the baby is not sensitized to the dairy protein early on, they will more likely have dairy allergy as they get older, so we used to say when babies had really bad dairy allergy and mom's going to have a second baby, we told moms not to have dairy when they're pregnant and whatever. That was the wrong thing to say, wrong thing to do back. Now we know mom needs to sensitize the in utero baby to the cow's milk, if they're going to tolerate the cow's milk as they get, as they're born, that sort of thing. So, that if that's a basic question, it's the same way we know now with peanuts and with eggs and those kind of things that there is a more potential for the babies to have allergies if they're not exposed to those things early on. So this whole field of allergy is really evolving and interesting, but there's so much we don't know about it. It's sort of like the neurological system. We haven't been able to study the brain and the nerves very well. Well, the gut is so complex. It has its own immune system that's separate from our systemic immune system. And so, but we're learning a lot more about these things as time goes on. There's a lot of research that goes on in this area.
Yes. When talking about Pedialyte, what age can we give baby Pedialyte?
Down to 0. Okay. It's totally safe. Yeah. You don't want to give it in place of formula, I should mention, okay? Because I don't want the baby to drink Pedialyte and not get enough calories, so just using it, like I said, in supplementation to formula, that sort of thing. But yeah.
Sure. Okay, so could you clarify, we need a little bit of clarification. So I believe it was, when you were saying cutting out dairy for maybe 3 weeks to trying to see if that was irritating it. This user says, when mom cuts out dairy, the baby is still drinking mom's milk daily. How does that help? If you can explain.
So the reason to do that is some of the cow's milk proteins that mom is consuming can come through the mammary gland. There are, cases where babies can be actually allergic to the mammary proteins though. But those proteins again are derived from the proteins in mom's diet. So, that's how we figure it out. Now, I'll tell you, most babies that have breast milk colitis, and even if mom is on the dairy protein free diet, they're the hardest ones to treat because they seem to have multiple immune type reactions to those proteins. And if I have a baby with breast milk colitis that doesn't get better with mom on on a dairy protein free diet for 3 weeks, and that baby's losing weight or still having blood in their stools or whatever, they end up going right to the Cadillac formula because it takes a real removal of any protein irritants in their system to get over it.
Mm-hmm. Perfect. Thank you. Okay. Do anti-colic bottles actually work?
Again, it's highly variable. The reason so many of those different bottles exist is because no one bottle works for everybody. So, it's kind of a crapshoot, so to say, whether it'll work or not. I've not seen any again scientific basis for it, but every human, every baby is uniquely different. So I hate to make global statements about something working or not working because we just don't know.
Yeah, I see a few of those questions are, what's your favorite bottle and what's your favorite formula? It's hard to say for that stuff.
As long as the formula is FDA approved, manufactured in a facility that's high grade, and they all are in the United States, that they're fine. There's no real favorites per se.
Perfect. Okay. Is it safe to use Warmies? They are lavender scented microwavable stuffed animals. Have you heard of those?
No, but I mean, it's probably along the concept of, a warm blanket on the baby's tummy when they have colic. I mean, that's certainly worth trying. Some babies get better when you put them in a warm tub. Some get exactly the opposite in a warm tub. But, that it's like the heating pad theory, and it helps some, doesn't help others, but it's certainly not. And lavender is, safe. Chamomile, there have been chamomile products out for babies with colic. And I was just on in a meeting last week, and there actually was a presentation on some benefits. It was a Chinese study, but using a lot of chamomile with babies and just the scent of it even it was helpful for fussy babies. So, yeah.
That's a good tip.
Mm-hmm.
All right, we'll just do a few more questions here. The next one says, what about moms who are developing maybe some more food sensitivities during pregnancy, but maybe they don't have them prior to pregnancy? Will this correlate with food sensitivities when baby is born?
Not that I have ever seen. Again, the pregnant body is so uniquely different in its immune function and what all is going on in the body. It definitely have not seen that correlate to the baby having problems. So, again, where we talked about the mom being vegan or whatever, and if it gets to that extreme, maybe the baby will have problems later on if they have this significant restriction that they need to do in pregnancy, but generally not.
Sure. My 3-month-old spits up when she nurses, but not when she is bottle fed. Should we just stick more to the bottle?
No, I would always say, as long as the baby's gaining weight, don't worry about the spitting up when she's nursing. Nursing is the best. I mean, breast milk is the best. And so, again, unless they're having, enough spit up not to gain weight or, other issues, just stick with that.
Okay. And then we had one last question here. We'll answer this final one. I know we talked about cow's milk formula, but what about the alternatives like goat milk formula? Do you have anything to say about those?
Yeah, they're typically mammalian milks or milk from mammals. They're typically not as nutritious as the cow's milk are. Goat's milk is pretty similar, but if a baby has a reaction to cow's milk protein, there's a 95% chance they will react to the goat milk within 3 weeks. There's a 70% cross reactivity even with soy formulas. But in terms of the mammalian milks, the least allergenic mammalian milk is actually camel milk, which you can get, or you used to be able to get anyway from Israel. But anyway, I mean, there are some milks that are, adaptable to use that are less allergenic. But, goat's milk used to be a go-to for people before we had all these specialty formulas. And there might be an occasional kid that did okay on it, but more than likely they just outgrew whatever their irritation was as they were on the goat's milk. But previously the goat's milk also was deficient in B vitamins. So we were really, especially fresh goat's milk, you definitely don't want to use because it's deficient in B vitamins. But the newer goat milk, canned goat milk things now have those things supplemented in them now that we know that they were that deficient in those things. So that's always the risk, is that they're going to lack certain nutrients, which are important for especially neurological development.
Mm-hmm. Definitely. So moral of the story with that is definitely consult your pediatrician for help with switching formula. And then obviously we can always help you additionally with Rose and her clinic too. So.
Yeah. But breast is best. Breast milk is best. Yes.
Okay. Well, thank you so much for all of your questions. We really appreciate that. And we're going to go ahead and draw for our winner today. So spinning the wheel here, we have Carly K. Congrats, Carly. You are our winner. So I'll send you a message from our pediatrics page so you can claim your prize.
Cool.
Well, Rose, it has been great. I mean, even just talking with you during this, I can tell just how knowledgeable you are on all of this with all your years of experience. So thank you for sharing that with all of us today.
You bet. I love taking care of babies and their nutrition. So I think everybody in our department does, and it's a passion.
Yes, wonderful. Well, we still have one more live tomorrow, and that is going to be prioritizing mental health during pregnancy and after baby, which is a topic all parents should tune into, whether you are the gestational parent or the partner. Send this to your partner if they want to watch too, because mental health is for everyone. So we look forward to that tomorrow, and we will see you all later. Thanks, everybody.
Thank you.